Meanwhile, the introduction of ARVs in 1996 was a turning point for hundreds of thousands of people with access to sophisticated healthcare systems. This narrative has, however, changed these past few weeks, with lack of ARVs in the country presenting itself as a nightmare to Kenyans living with this disease. However, the Kenyan government is resorting to begin manufacturing its own HIV drugs. Faith Wambua reports.
The Kenyan government is pursuing a public-private partnership framework to locally manufacture HIV, malaria and tuberculosis drugs to reduce over-reliance on donors in the war on the three diseases. National Treasury Cabinet Secretary Ukur Yatani says the government is working towards providing an enabling environment for private sector investments. This decision comes after the country recently faced an acute shortage of ARVs following a standoff between the government and donor agencies caused by a tax war between Kenya and USAID, which avoided Kenya Medical Supplies Agency and instead shipped ARVs and test kits through a private US company, KENYAN International. Many have, however, borne questions on whether the country will be able to manufacture its own medicine or not.
Well, I'm sure now that they have the basic knowledge, if you just in a little variation, they should be able to make some vaccine for human beings, so long as they get the patency. So I don't think it's a big issue. It may be some challenge at the beginning, but it's a possibility.
According to experts, it is very possible, despite the process being long, it will require determination and coordination.
But most countries realize that they should be independent, self-sufficient. So that's why now it just dawned on us now because of this pandemic.
There are companies in Kenya. You go to industrial area, you go to Kikuyu, and all they produce drugs. It's no different. It's no different. So it's the willingness. We just need to facilitate them. And some of the facilitation including maybe reducing taxes on raw materials, training experts to be able to be in that field.
After endless cries from people living with this disease, a ray of hope has finally shown itself. Faith Wambua, Switch TV.
Thank you, Faith Wambua.